Prior to PRISM being set up, it felt quite lonely in practice, so I'd either see a patient at home or in surgery, and
I think one of the main issues that we have is referring to other professionals, because there's a lot of other people involved in their care.
I felt isolated, that there were specialists at hospital or specialist teams out there somewhere, but I didn't have easy contact with them.
The main concerns that raised was that you spend hours on the phone or completing paperwork in order to make that referral.
All these things took time, and meanwhile the patient's waiting for these services to start.
And it can be very frustrating for them and for us as well.
The problems are going to be vastly increasing numbers of patients with long-term conditions and multiple long-term conditions. That number is just going up and up and up as every year passes.
At the moment, often practices work very reactively, so you're caught out sometimes by patients with big needs.
The biggest change and key benefit of PRISM is lots of different clinicians, care workers working together as a team, as a close-knit team for the benefit of patients, which has not been done before.
I was really excited to be working as part of a new team because I felt that it was going to be positive for the patients, and I think that, you know, all being located in the same building was going to be a major advantage for all of us. So I think it's made a major difference to the way that I work, because we can have informal discussions about the patients that we see, and those informal discussions can save so much time.
The other really helpful thing is that then we can go out together. We do a lot of joint visits, and it means that the assessments can be taking place together. We can be doing our assessments in one visit, and it makes my assessment fuller and gives a rounder picture of the whole person, and then it makes it easier to support them and to give them the services that are really going to improve their lives and make things easier for them and prevent them from going into hospital.
Well, importantly, the carer is the focus in this as well. So what they have to say is heard. Also, what the family has to say is heard.
What's different now and what is really lovely is that I know the team, and I can say to a patient, look, a lady called Faye's going to come round and she's going to help you with maybe some of the anxieties you've been experiencing, or a lady called Michelle's going to come and see if there's any extra help we can give you at home. And I know these people, and that gives confidence to my patients.
It can happen within a week that things have changed for them, which is lovely to see. It makes it quite humbling to go and see that you have made a difference.
So for me, PRISM is important because it's not just the health professionals who are within the team, but they have recognised and embraced the fact that there are services outside of the health profession that would actually support. It's the holistic approach that I like.
There's a lady, her name is Pam, and she's given me permission to talk about her. And she said to me that before PRISM, she felt she didn't want to bother us. And she said, it's just you, doctor, and I don't want to bother you because I know how busy you are. Now she knows that I'm part of a bigger team. She feels supported, and she hasn't been in hospital for months now. She's really well. She's the best I've ever seen her. And she says that she doesn't feel afraid to ask us for help, and that's just brilliant.
I think for the process to work, it doesn't work with just one party or one GP practice or one organisation. The whole point is to integrate care for patients, to pull information and resources and center them around the patient themselves, rather than around the organisations and how they want to work. So for that to be successful, it's essential that all organisations partner together, as they are doing, and work well and put the patient at the centre and put aside their own priorities and ask, what does it mean to put the patient first, to provide services and care in a way that will best benefit our patients? And that's exactly what we're doing with PRISM.
The enthusiasm for this system, which is unique to Newark, is amazing. It shall work because we utterly and completely believe it's in the best interests of patients that they should be treated where they are most comfortable. I have recently had experience of a couple who have had a whole series of husband falls, 999, hospital, and this had gone on for several years. He also has prostate cancer, and he has lots of other things that are ongoing and long-term conditions. And the cycle was getting worse. It was approximately every 3 months that he was going to hospital. Last June he fell. Back to hospital he comes, but this time he was transferred to the community ward. Whilst he was there, he was thoroughly assessed. He was taken in an ambulance to his home so they could see what he needed at home, and a team was put in place. The major difference being when someone comes now, it's someone who has their medical history. Since he's been having the home help, he's literally been able to get to walking with a walker again. And a fortnight ago, for the first time in about 4 years, he actually walked with a stick. So for her, it's peace of mind. It's not having to worry in the dark moments in the middle of the night whether or not you ought to ring 999 or if it will be crying wolf, which is what happens if you don't have a team. It's about the fact that the anxiety doesn't build up, because she knows there are people there not just for her husband but for her as well. Since the fall in 2013, he's not been back to hospital because the care team anticipate what problems may come, or they can discuss what problems are starting to come, and they can nip them in the bud because they can always bring in another member of the team if another skill is required. That is the secret of PRISM, and it's wonderful and it works.